shallow breathing, habitual
Mm.
shallow breathing, and you just said not being able to deliver oxygen or nutrients to the blood.
Yes.
That's exactly. And so we have plenty of individuals who are chronic hyperventilators in a way. It's weird to think about, but they don't have a good breath in, breath out. They maybe are stuck in a flexor dominant state a lot, poor posture, upper cross syndrome, super stressed all the time. Can't remember the last time they probably ever actually sat in a room by themselves and just breathed for a minute or two. And maybe it's someone who has 4 kids and works a job. And it's not that their life is in shambles, it's just they're so busy that they never had a chance to just sit and relax. I can understand that too. So,
And that's exact same situation. And I've done this with an individual. It's been a while back. I think maybe when you were working here still, to where it was a parent, and I challenged him. I said, okay, YouTube, Google, doesn't matter. Breath work, game, or challenge with kids. And then it goes through like a simplistic kind of activity, and then you bring your kids into it. Obviously, it depends on if they're able to like understand, and then go through that challenge with them together.
yep.
So then you're teaching your kids, you're de-stressing yourself,
And
bring
you
everyone together.
and you get your 10, 15 minutes, hopefully.
Hey, there you
Heck,
go.
you might put them to sleep. That's like a real win, but you'd be surprised.
Yes.
So this habitual pattern of breathing too rapidly or deeply,
Mhm.
especially through the mouth and chest, even when the body doesn't require more oxygen, disrupts the O2 CO2 balance. And we're going to talk a little bit about that right now.
Love it.
When we are breathing out over a chronic state, we are lowering the amount of CO2 that we have in the body. Now, this can affect pH regulation and it impairs oxygen release from hemoglobin. So we just talked about the Bohr effect. When we actually increase the amount of CO2 in the body by hypercapnia, which is holding your breath, that increases CO2, kicks oxygen off our hemoglobin, and our body now is able to use that oxygen in our cells. So we don't have that oxygen delivery with poor CO2 levels. There is more sympathetic system upregulation, which increases anxiety and muscle tension. Chronic chest breathing causes tension in the accessory muscles, weakens the diaphragm. It probably can cause a lot of even the pains. Dr. Jace is just talking about one of his patients, a lot of chest pain, tightness. Maybe
Yeah.
they struggle with panic attacks too. But this leads to paradoxical breathing patterns and overall fatigue over time because it can cause lightheadedness, tingling in the fingers and lips if it's really bad, anxiety, panic attacks, shortness of breath, despite increased efforts to try to improve this.
Yeah, I think even, and this is not every person, it's more on the rare side. If you start noticing you have this pain when breathing, well, one, you might either have a rib at a place to where it's forcing muscle spasms along the rib cage or on your backside. So you might want to see a chiropractor or PT just to either work that bone into place. But if let's say you have, and this is going back to what Doc said with that patient that we have, to where he's having consistently tenderness, pain one side, but it's a little bit on both, to where you just can't get that to recover. Definitely flexor dominant. So what we're working on is opening things up. We're gonna go, after hearing some of this stuff, way more on the breath work, inhalation, opening up the rib cage, and that goes back into the bucket handle, which is anytime you tilt side to side, it opens up the ribs, usually on the sides, versus the, what was the other one you said?
So we have the bucket handle and then we
Side to
have the
side.
pump handle.
Pump handle.
Yeah.
So forward and backwards, if you think you're pumping a well, same thing with the sternum, opening up the opposite way. And then if you want to create an apex where the biggest area of curvature is, so it would be tilting away. So let's say if your eyes are not watching the video, we have pain on the front left side. You would want to extend back and then tilt to create where that area is. And you want to almost open and stretch it up and then go into some breath work from there, build it up in terms of the amount of time of your session of breath work. But
Yeah,
it's just an avenue I want to explore a little bit more with him.
I do too. Like I practice a lot of breath work, but I want to be so much more intentional after
Yes.
hearing a lot of these things, especially for patients too. There's so many patients now that I can't wait to use this on just
Same.
because of how helpful it was to hear all this. But so, Doc, you had just provided a few research articles for actual certain medical conditions
Yes.
and how breathwork has shown to improve those. And do you want to just touch on that really quick?
Absolutely. So I know we brought up asthma, where it's harder for you to take breaths in. Usually that's due to a vasoconstriction of the bronchioles due to any irritation, more on a chemical signaling pathway, but then also it can have an inflammatory connection as well. So if you have allergies, it can induce asthma. If you have sports-induced asthma where it's harder for you to take breath in, that can sometimes follow if you're in a cold environment, let's say hockey, or you're outside in like cold winter sports
Mhm.
where you're increasing the amount of effort that you are able to go into. There's that connection to where for some individuals it can induce asthma, which makes it harder to breathe, get a full breath in, and then it limits, obviously, like Doc said, with the Bohr effect, blood and tissue healing from there. We're noticing breath work, like we said previously, improves the CO2 tolerance and how you can either hold the CO2 in your body and then through the coldness or through the effort breathing that out, which helps for the bronchospasms. Same thing with nasal breathing and techo style breathing also have shown positive results.